Welcome to Lecture 2 of our journey through the body's vital organs. Today, we meet the relentless drummer of life, the heart. Beating 100,000 times a day, this fist-sized powerhouse circulates your entire blood volume every minute. Its rhythm is the soundtrack of your existence. Let's learn to protect its melody. Heart disease is often silent until a crisis occurs. Learn to recognize its whispers and shouts, feeling exhausted after simple tasks, especially when lying flat or with minimal exertion. Not always pain, often described as pressure, squeezing, or fullness, particularly in women, frequently mistaken for stomach issues. Gasping for air at night stresses the heart, fluid buildup from poor circulation, feeling like your heart is fluttering, pounding, or skipping beats. Seek immediate medical help. To jaw, neck, back, shoulder, or arm, especially left side. Sudden dizziness or fainting. Cold sweats with chest discomfort. Extreme shortness of breath at rest. Blue-tinged lips or nails. Crushing chest pressure with nausea. Classic heart attack signs in men. Doctors calculate your 10-year cardiovascular risk using factors. Step 1. Risk stratification. Step 2. Diagnostic tests. Records. Heart's electrical activity. Ultrasound, showing heart structure/function. Monitors heart during exertion. Detailed artery imaging. Gold standard for coronary artery disease. Troponin for heart attack. BNP for heart failure, for rhythm abnormalities, for hypertension management, smartwatches detecting atrial fibrillation, the cardiac-friendly plate, wild salmon, mackerel, walnuts, chia seeds reduce inflammation, anthocyanins protect blood vessels, spinach, kale improve artery function, oats, barley lower cholesterol, beans, lentils, control blood sugar and cholesterol. Almonds, flax seeds provide healthy fats and magnesium. Flavonoids improve circulation. Minimize or avoid trans fats, excess sodium, added sugars, processed meats. Garlic shown to modestly lower blood pressure. Traditional tonic for heart function. Especially important if taking statins. When dietary intake is insufficient, crucial for heart rhythm stability. Never replace prescribed heart medications with supplements without consulting your cardiologist. Move consistently, 150 minutes. Moderate exercise weekly, twice weekly. Muscle is metabolic armor. Poor sleep increases heart attack risk by 20%. Practice mindfulness, deep breathing. Heart attack risk drops 50% after 1 year smoke-free. Max 1 drink, day for women, 2 for men, especially reducing abdominal fat. Gum disease increases heart disease risk. Loneliness impacts heart health as much as smoking. Optimal 120/80 kg, what you can do. Today, rich in fruits, vegetables, low-fat dairy. Aim for 1,500 milliliters daily. Sweet potatoes, bananas, avocados. Home blood pressure checks. If prescribed, take consistently. Check your numbers. Know your blood pressure and cholesterol. Improves post-meal blood sugar spikes. Try the Mediterranean diet for 1 meal daily. 5 minutes, twice daily. Heart health starts in your mouth.